Hi there, this is Beth Wills, and I'm going to be doing the IV direct um, assessment or video, I guess. Sorry about that. So off we go. Okay, so the first thing I would do, of course, is I would do hand hygiene, obviously. And then what I'm going to do is I'm going to look at the physician's orders. And what I'm going to do is I'm going to compare the physician orders to the bridging document we have. So the patient's name is Cupcake Lab. Cupcake Lab. The patient's date of birth is December 3rd, 1958. December 3rd, 1958. The patient's number is 79481. 79481. We're also going to look to see that this patient has allergies to Cipro, and the reaction is the throat swells. The patient has a diagnosis of query chest infection with a GI bleed. We're also going to go down in the orders and look for the medication we're going to give, which is dimenhydrinate, 25 milligrams, IV direct now. And the order also says to do a saline lock between meds. Okay. So after we've checked the physician's order, we're going to move on and do the patient MAR. And again, we're going to use the bridger to check the patient MAR. Patient's name is Cupcake Lab. Cupcake Lab. Patient's date of birth is December 3rd, 1958. December 3rd, 1958. The number is 79481. 79481. The date is today. The allergies we already saw on the physician's order, but double checking. Cipro and the throat swells. And we're going to go down here to our medication order, which is dimenhydrinate, 25 milligrams IV direct now. If there was a medication administration time here, we would check it to ensure that we're not giving Gravol again, as we shouldn't be. Okay. Then what we're going to do is we're just going to talk about our med math and how we figured it out. So I'm going to hold the med math up to the camera here, and I'll bring it out a little farther here so you can see. And up one more time just so that you can see. And back one more time. Okay, so basically with the med math, we know that we're giving Gravol 25 milligrams IV direct. In order to find out how much I was drawing up into the syringe and out of the vial, I divided 25 milligrams by 50, which gave me 0.5 mils. So the 0.5 mils is the medication, the dimenhydrinate, that we're going to be drawing out of the vial and up into the syringe. Also, in order to figure out how much diluent to use, we also did some med math here. And we found out that we're going to be using 4.5 mils of diluent. And it's going to be a total of 5 mils in the syringe. So the 5 mils is going to be the total volume in the syringe. The 0.5 mils will be the medication by itself. And the 4.5 mils will be the diluent, which is the normal saline. Using our med math, we also figured out that we can give this at 1.25 mils in 30 seconds, or for MedEase, we can give 1 mil per 30 seconds. And we decided to give 1 mil per 30 seconds for ease of use. We're going to give it over 2 to 4 minutes. We decided on 2. And here is our med math here to figure out how many mils per second that would be. So that's our med math. Okay. The second thing we're going to do is we're going to, again, check the monograph. And we're going to make sure that we can give dimenhydrinate and make sure that actually is the drug. So we'll go back here and we'll look. It says dimenhydrinate, 25 milligrams IV direct now. Dimenhydrinate, direct IV. Yes, it's safe, 25 milligrams. And again, on the MAR, diamond hydrogenate, 25 milligrams, IV direct now. Okay, that's great. We're going to move on in the monogram, and we're going to look for adults. It should be monograph, not monogram. Monograph. Gosh, I can't speak. Okay, so the first thing we're going to do is we're going to look at the dosage. Now, the usual dose for this in adults is either given IV or IM. 50 to 100 milligrams every 4 to 6 hours is needed. But this is not a normal dose. It's to be given direct IV. So we have to skip down to the direct IV here. And we have to look at the directions there. And it says, we'll double check, administer concentrations up to 5 milligrams per mil over 2 to 4 minutes. So we'll just look at our math, med math, and that agrees with what we figured out. We figured out our total to be 5 mils. We knew we were going to give it over 2 to 4 minutes. We chose 2. So our med math agrees with this, and we're good to go. So we're just going to flip over to the other page, and we're going to look at the product description. And again, we're going to make sure that diamond hydrogenate is compatible with what we have, and it is available as a 50 milligram per mil injection. And the diamond hydrogenate we have is a 50 milligram per mil injection, so that's compatible. And we're also going to look at the solution stability and see that it is stable with normal saline, which we have normal saline here, so we're good. And we're looking at the compatibility site, and this is basically compatible with normal saline. So again, we have our normal saline here, and we're going to use this as our dilutant for dilution. So we should be good there. And it's compatible with the Y site. Okay, so we've checked all of those 3 things. So the next thing we're going to do is we're going to do our first medication check. And the first thing we want to do is make sure that this says diamond hydrogenate 50 milligrams per mil. This is Cupcake Labs, December 3rd, 1958, December 3rd, 1958. Diamond hydrogenate, we're just double checking our physician's orders here. Diamond hydrogenate, 25 milligrams, IV direct now. We'll also check on our mirror. Cupcake Labs, date of birth, December 3rd, 1958. Number is 79481. We'll also check the number on here, 79481. Again, we know allergies to Cipro. Make sure this isn't Cipro. This is not Cipro. It's diamond hydrogenate. And the date is today. And again, we'll check the order, which is diamond hydrogenate, 25 milligrams IV direct now. It's great. Just to ensure, we'll also check it against our monogram. So we know that we have diamond hydrogenate 50 milligrams per mil. We'll check with our med math too, just to as another double check. So again, we're doing Gravol, diamond hydrogenate 25 milligrams IV direct, 50 milligrams per mil. And again, if we look at our med math, we can see that it's 50 milligrams per mil. So, okay, that's great. Okay. So I'm just going to leave my med math here and the physician's orders here and everything here. So we've done our first check. So that's a good thing. And just because I like to be very careful, again, I'll pick it up. Diamond hydrogenate, 50 milligrams per mil. Okay, great. Okay. So the next thing that we're going to do is we are going to take the tops off of these. So we'll just pop the tops off. Okay, great. Okay, and the next thing we're going to do is we're just going to take some alcohol swabs, and we're going to swab both the diluent and the medication. So the medication first, which is diamond hydrogenate. Make sure we get that a good swab. And we'll just let that air dry. And we'll do the same thing with the diluent, which is the normal saline. Again, checking to make sure that this is normal saline. Normal saline. And again, just because I like to double check, we will double check this with our order. So Cupcake Labs, December 12th, 1958, December 12th, 1958, 79481, 79481. We'll check with our physician's orders, and it says saline lock between meds. So we will check that with our med math. And we are using normal saline as a diluent, so that's great. We will also check that with our monograph and see where it says, see where it says for diluent. So here it is, IV solution stability, normal saline. Okay. So great, we have the right drug, and okay, we have the caps off. Okay, so the next thing we're going to do is some more hand hygiene. Okay, and we're going to open our syringe here. We're also going to open up our blunt needle as well. Again, maintaining sterility. Okay, so those are both open, not touched. Okay, so obviously we are going to take our syringe out of the package, and we're just going to connect it to the blunt filled needle. Okay, so we can get rid of our garbage here. Okay, we'll get rid of the garbage. Okay, so the first thing we're going to do is we're going to draw back air of 4.5 milliliters. And again, we'll check our med math and make sure. So the first thing we're doing is we're doing the diluent first. So we're checking our med math totals to ensure, and sure enough, it says we should be drawing up 4.5 mils as per our med math. So we're just double checking that. Yes, that's all good. Wonderful. And so we're going to draw back 4.5 air first. So we will draw back 4.5 air. And once I get it here, I'll show you. Okay. So I will show the camera that we've drawn back 4.5 air. Just move my fingers. Hopefully you can see. I'll bring it out. So again, 4.5 air. Okay. And what we're going to do is we're going to take the cap off. We're going to pick up our normal saline. We are going to put it in against the wall. Just kind of put it in there against the wall. Great. And we are going to inject 4.5 mils of air in there. Okay, great. Okay, after we've done that, we can take it out. Okay, we're going to recap. Great. Okay, so we've done that, and again, just because I like to double check, that was the normal saline that we took the 4.5 mils of air out of. So again, normal saline. So that was great. Okay, so the next thing that we're going to do is we are now going to concentrate on our medication. And again, according to our med math, we want 0.5 mils of medication. So the next thing we're going to do is draw up air in 0.5 mils. Again, I'm double checking to make sure this is dimenhydrinate, 50 milligrams per mil. Again, with our order, dimenhydrinate, Gravol IV Direct, Cupcake Lab, December 3rd, 1958, Alberta Health Number 79481. Okay, so dimenhydrinate. So the next thing we want to do is we're going to draw up 0.5 mils of air. So again, when I get that ready, I will show you. Okay, so this is 0.5 mils of air. Again, I'll put it in the camera. Okay, 0.5 mils of air. Okay, so what we're going to do this time is we're double checking. Again, this is diamond hydrogenate. Taking the cap off. We're again sticking this into the wall, and again we've already alcohol swabbed this, so this should be good. So into the wall, and we're going to put 0.5 mils of air in there. Then we're just going to turn this upside down, and what we're going to do is we are going to pull back until we get 0.5 mils of air, and as soon as that happens, I will show the camera. So 0.5 mils of air here, double checking, 2, 4 right in the middle, 0.5 mils of air, and again you can see it's diamond hydrogenate. So this is a good time to do our second check. The reason why we're doing our second check this way and now is because if we have a cosigner, they can come along, they can clearly see that we have diamond hydrogenate and how much we've drawn up. So even though this is a little awkward, I am going to move everything and double check. So again, we're looking at the patient record, patient MER, and physician orders. Okay, so Cupcake Lab, December 3rd, 1958, December 3rd, 1958. Alberta Health number 79481. Allergies we already talked about, to Cipro. Again, looking at the order, diamond hydrogenate, 25 milligrams IV direct now. We figured out our med math. It should be diamond hydrogenate, 50 milligrams per mil. We're holding diamond hydrogenate, 58 milligrams per mil. We'll check that with the physician order as well. So we have Cupcake Lab, December 12th, December 3rd, 1958, December 3rd, 1958. Alberta Health number 79481. We're also giving this today. We know we have the allergy to Cipro. This is not Cipro, this is diamond hydrogenate. And again, we'll go down the orders, and diamond hydrogenate, 25 milligrams IV direct now. This is the diamond hydrogenate. Okay, we're good there. Again, we have the monograph for the diamond hydrogenate, and of course the med math. So that would be our second check. Now, while we've been talking here, this might have, moved a little bit. So I'm just going to pull down to make sure that we have 0.5. And again, we have 0.5. Okay. So what I'm going to do is I am going to take this out now, very slowly. Okay. I am going to ensure that, ensure that this is at 0.5 again. Just making sure 2, 4, and the middle plunger is. We're going to recap. Okay, and before we recap too, we should also make sure that there's no bubbles in here. Recap and then do bubbles as well. If there are bubbles in here, what it will do is it will ruin the concentration of the medication. So we'll just tap that. Just tap it. Okay. Okay. Tap to get all the bubbles out. Doesn't appear to be any air. Don't appear to be any bubbles. We'll just check and make sure our dose again is 4.5. It's looking pretty good. No bubbles. So this is the dose, 4.5. Sorry, I keep saying 4.5. It's 0.5. The dose should be 0.5. I drew up 0.5 and it clearly shows 0.5. 0.5. Okay. Again, 0.5. Okay. So we have the diamond hydrogenate drawn up. So the next thing that we are going to do is we're going to look at our med math. And now that we have the med drawn up, we also see that we have to have 5 mils total in the syringe, and that 4.5 mils have to be the diluent, which is the normal saline. Okay, so the second thing we're going to do is we are going to draw up the normal saline. And we're just going to give it a swab here. We'll put the Gravol aside. We've already drawn that up. Okay, here we go. Just going to swab this one more time. Let it air dry. Okay, great. And we'll get rid of that. Okay, so the next thing that we are going to do is we are going to draw up 4.5 mils of the normal saline. So let's double check it again. This is the normal saline, 4.5 mils. Cupcake Labs, December 3rd, 1958, 79481. Cupcake Labs, December 3rd, 79481. Cupcake Labs, December 3rd, 79481. And our med math as well. Okay, and this is normal saline. So the next thing we're going to do is we are going to uncap this, and we are going to draw up 4.5 for actually a total of 5. So I'll just put it in here, and as you can tell, it's springing back quite fast. So we will make sure this says 4.5. And when we get there, or 5, sorry, because we're drawing up, we already have 0.5 in there, so we're drawing up 4.5 for a total of 5. So as soon as we get there, I will let you know. Okay. Okay. Okay, great. Okay, good. Okay. So again, we'll just click this for bubbles. Okay. Okay. And at this point, what has happened is we have a huge bubble in here. And then we have another problem, because if you can see, we have a lot of air on the top. So to fix this problem, what we would do is we would have to start all over again using the procedure I showed you. So we would discard this, we would get an entirely new syringe, and we would basically go through the whole process again. Because if you were to use this now, it would be incorrect because there's a big air bubble there. And if you push this back into the normal saline, what this is going to do is it's going to push medication into the normal saline, and it's going to make this incorrect. So I'm going to, like I said, we're going to assume that we've discarded all of this. We've done the whole process again. And even though this has a huge bubble in it, and we're going to assume that this is correct, and this is supposed to be the 5 milligrams. So again, what I would do to fix this is we would discard all of this. We would do the whole process again, get a new syringe, get a new needle, draw everything up, do our checks. Okay. But in the interest of time and for the video, you've always said that we can kind of fix our issues, so that's what I'm going to do, and we're going to assume that this is okay. So we're going to pull this out. Okay. And we're going to recap this. And again, we would, do the bubble thing before and after. Okay. And we are now going to put our sticker on. And I should show the camera. Please excuse the air bubble, but we're assuming this is exactly like 5 milligrams, which it clearly isn't. But please assume this is 5 milligrams of the medication. We've started again. We've fixed the issue. Here is the 5 milligrams. And I'm going to put the medication sticker on this. I'm not going to cover the numbers. I'm just going to kind of put it on here. And on the medication sticker, we have the drug, which is diamond hydronate, 25 milligrams, in a concentration of 5 milligrams per mil. My initials, the patient is Cupcake Labs. The room number is 79481. And the special instructions are to administer 1 mil every 30 seconds. Now would be a good time to do our third check. So I'm just going to do that. So we're going to do our third check. So here's our medication. So first of all, again, Cupcake Lab, December 3rd, 1958, December 3rd, 1958, 79481, 79481. The order is for diamond hydronate, 25 milligrams, IV direct now. Here it is, diamond hydronate, 25 milligrams, okay. Cipro, again, we'll check it with the physician's orders. Cupcake Labs, 79481. Date of birth is December 3rd, 1958. Again, looking at the orders. Diamond hydronate, 25 milligrams, IV direct now. Saline lock between meds. Okay, that's great. Again, we'll check our med math as well. So we should have a total of 5 mils, which we do in the syringe. We took out the 0.5 of the diamond hydronate. We took out 4.5 of the normal saline, the dilutant, to make 5 total. And we're going to give this at 1 mil per 30 seconds. And again, diamond hydronate, direct, yes. Med mass, good. Double check that. Showed the camera, please fake it. It's 5 milligrams with no air bubble and everything's good. Okay. All right, so we've done that. So we have our medication here. We have our flushes here. We have our alcohol swab here and our cap here. Okay. So the next thing that we're going to do is, because we don't do red at bed, we are going to take the needle off and replace it with the cap. Okay, again, maintaining sterility. So we'll just take the needle off here. Okay, blunt filled needle, and we'll just put the cap on, twist it. Okay, great. Okay, cap is on. You can get rid of this and the sharps and this and the garbage. Great. So the next thing that we're going to do is we are going to get our flushes ready. So we're just going to open those. And again, maintaining sterility. So we're just going to pull the plunger back a little bit and just break the seal by pulling it a little bit. Great. We'll take the cap off. Okay. And we'll open the second one. Okay. And again, we'll pull back and we'll pull a little forward just to break the seal. Okay. So we'll take the caps off of those. And actually, no, I prefer to leave the caps on. I do want to leave the caps on until we get to the room. That is just, for me, that's safer practice and my preference. Okay, so now we have the medication. We have the 2 syringes. We have an alcohol swab. And the next step is I'm going to do some hand hygiene, and we're going to go in and see the patient. And we're going to assume that the patient is wearing this armband. Okay. All right. And we're also going to take our ridging document with us. Okay. Okay. So I'm going to do some hand hygiene. I'm going to knock on the patient's door. I'm going to introduce myself to the patient. Hi, my name is Beth, and I'll be your LPN. And I'm just going to give you some Gravol today. But before we do, I would just like to check your patient identifier to ensure it is you. Can you please tell me what your name is, please? Your full name. Cupcake Lab, great. And can you tell me your date of birth? December 12th, 1958, great. Okay, December 12th, 1958, and Cupcake Lab, great. And your number, please? Your Alberta Health number, 79481, 79481. Great, 79481, 79481. Wonderful. And I guess that I'm seeing that you have some allergies, or you have an allergy to Cipro. Okay, can you tell me what happens when you have Cipro? Okay, it makes your throat swell. Well, the medication we have for you today is Gravol, not Cipro, and we'll ensure that we don't give you any Cipro at all during your hospital stay. So we'll make sure that we don't do that. In addition, I just want to give you a little bit of patient teaching about the Gravol here. First of all, Gravol was prescribed because I guess you're feeling quite sick or quite ill. Okay. You have some nausea? Okay. Right. On a nausea scale, could you tell me where your nausea is? Okay, it's at a 6. Okay, well, the Gravol should work within 30 minutes to reduce your nausea. And if it doesn't, can you please ring the call bell and let me know? And then we'll either contact the physician to get more medication or perhaps use a new one. The other thing I'm going to just patient teach you about is you're probably used to having Gravol by mouth or taking it by tablets. Have you had it that way before? Yes, you have. Okay, well, this is a little bit different because this is actually going right into your circulatory system. And so what may happen with this is you may feel a little dizzy or woozy or tired when you get up. And if that happens, or if you feel that when you start to sit up, if you could ring the call bell and I'll accompany you just to make sure that we ensure your patient's safety and you don't fall. So that's the other thing I want to tell you. So do you have any questions about the procedure? Anything at all you'd like to ask? Okay, all right, great. So if you're ready, I guess we'll get going. Is that okay? Great. Okay, cool. Wonderful. Okay, so the first thing we're going to do is we're going to look, and our patient here has a saline lock, meaning obviously that it's locked right now, and that is as physician order, saline lock between meds, so that is absolutely correct. And the first thing we're going to do is we're going to flush this to ensure that the site is patent. And I also want to tell you, Mr. Lab, that when I'm flushing, you shouldn't feel any pain or any coldness or see any swelling or anything at the site at all. So just let me know when we flush this, and hopefully that will not happen. So I'm just going to take an alcohol swab out here, and we're just going to clean the port. Give it a good scrub. Okay, we've cleaned the port. That's great. Okay, so the first thing we're going to do is we're going to flush. Okay, and this initial flush is just to check the patency of the site. So this one we can just kind of unlock the saline lock here. Okay. Again, we're maintaining sterility and we have gloves here. So, okay. And then what we would do is we would just flush it through. We would watch the site to make sure that, again, there's no coldness, edema, puffiness. The patient doesn't, complain of anything like that happening. And we can see the site is patent. So we're good there. So we can just, being careful to maintain sterility, we can just saline lock this again for now. Okay. Okay, great. And we can remove the flush. So we flush for patency, and we've seen that that's okay. Okay. So the next step is to actually give the medication itself. And again, I like to be super careful. So Cupcake Lab, 79481, 79481, and date of birth 120358, 120358. Okay, so now what we're going to do is we're going to give the medication. And as per orders and our med math, we are going to give the medication at 1 ml every 30 seconds. So what we're going to do is we're going to use our watch here, And when we start giving the medication, we're going to do it like per mil, which is why we didn't put the label over it. So the first thing I'm going to do is we've swabbed our port, going to uncap, and we're going to attach to the patient here. So we're just going to push and twist. Great. Okay. So we are going to, we can give them the first mil, and so we're going to do that. So we're going to go from 5 to 4 here. 5 to 4, and we're going to, okay. And then we're going to look at our watch and we're going to wait 30 seconds. We're also going to monitor the patient during this to make sure the patient is not having any issues. Okay, so we're assuming that everything's okay. So we're going to go from 4 now to 3, which is another mil. Okay, then we're going to wait another 30 seconds. Okay, then we're going to go from 3 to 2. Okay, and wait another 30 seconds. From 2 to 1. And wait another 30 seconds. And then from 1 to the end. Okay, so the medication has been given and the patient has tolerated this well. So now we can just disconnect the medication, and we can get rid of the medication. The medication can go in the sharps container even though it doesn't have a needle. And now what we're going to do is we are actually going to flush to ensure that all the medication goes into the site through the line. So we will take the cap off the second flush. Okay. Again, maintaining sterility, we'll twist and push. Okay. So what we're going to do with this one here is we're going to give 1 mil every 30 seconds for 3 cycles. So we'll start and we'll go up to 9, and we will wait 30 seconds. And then we'll go up to 8 and wait 30 seconds. And then we'll go up to 7 and wait 30 seconds. And assuming the patient tolerates the procedure well, then we can just push the rest of the medication through. Okay. So once all of the medication is through, we can disconnect the flush. Okay, again, maintaining sterility. We can re-lock the saline lock here. Okay, great. And obviously we get rid of everything in the sharps or the garbage. And that would be it for the medication administration. But again, we would tell the patient just to watch the IV site after we've given the medication to ensure again there's no redness or puffiness or coldness or anything like that. We would ensure the patient's safety, make sure the call bell's in reach, and the patient knows to ring us if they feel nauseated or dizzy at any time with the medication, answer any questions they may have about the medication. And that would be the end of the IV direct medication video. Thank you very much.